Hello everyone. Like you have already seen that for this video we're going to talk about how to study oral pathology. For oral pathology, I was actually searching about it on the web so that I know what kind of material you've already seen on the internet and what kind of help is already available. And I realized that the only video that I found was that how to study oral pathology without the books. And even that was not helpful because the one who was suggesting it was talking about not reading the book and just doing it from her notes, which I do not suggest. And yeah, so what I do suggest for studying oral pathology is the normal way, the conventional way, obviously. My way is to study it from the books. One book that I can suggest you for now is that you study it from uh, oral and maxillofacial pathology, that is contemporary, that is by J. Phillips Sapp and Louis R. Eversole and George P.Y. Saki. And this book has enough information for you for the undergraduates and I think for the postgraduates as well. But if there are more books for the postgraduates, then they should go for those. Then there is also another book that postgraduates have seen postgraduates and my teachers studying, and that is this one. You see, this is Oral Pathology, Clinical Pathological Correlations by Ruggiesi, and all this. This is the book that I've seen in my teacher's hand. So I do love this book. I tried studying from it but my paper mostly comes from the other book that's contemporary, so I do not read it much. The next thing that you can do is you can get your teacher's notes, that your teacher's slides in this kind of format, and then you can study whatever you're looking for, whatever you're doing in the class, and that's going to help you a lot. In the start, my teachers were not giving us these notes, these slides at first. So what I used to do was I used to make photos of every slide that came up. Obviously, I had to take permission from the teacher before the course started so that she doesn't mind. And Alhamdulillah, she did not mind later. But what you have to understand is that when you are writing all the things and you're trying to listen to the teacher and you're trying to make up a concept and you're making notes, sometimes it's obviously problematic that you have to copy all the slide work, everything that's on the slide in the presentation, and everything that's uh, everything that's also the extra material that teacher is talking about. So it becomes a problem, and obviously you will have to solve the problem, and for that you just make the picture of the slide, and then when you come home you mark it on your contemporary, that which is by J. Phillips Sapp and two other authors. So you actually mark all your work on your copy, on your book, and make notes if you feel like them. And you can also just mark them, like highlight your work, and just put sticky notes wherever you feel like. And that is how you do it. There is another thing that I'd like to talk about. I'm sorry that I did not have a proper background to talk about. For um, for these oral pathology, for everything in oral pathology, there are certain things that you need to know. When you study oral pathology in a good manner, that you study everything properly, you will not have to study oral medicine, because oral medicine is mostly what you study in oral pathology, and it helps a lot. For example, when you're talking about oral pathology, what you need to do is that you do for example, if you do a topic, you start a topic like, for example, benign epithelial lesions, and you're talking about squamous cell papilloma. You need to know what a squamous cell papilloma is, and when you know what a squamous cell papilloma is, you will understand the definition. Try to understand the definition, and if you find any word difficult, for example, I do think that most of you will know the meaning of this word, and most of you will have an idea because you have done pathology in your second year. But if you do not have an idea, just Google the word and get it in your head, so that if a teacher is asking you a question in the viva, you are very clear about what you're talking about. You, when you try to understand these words, you memorize the definition by itself, and at the time of in the exam you will know the main words, and then you will be able to write definition even if you haven't memorized it. So what are the important things that you need to know about everything? When you start a chapter, especially in the contemporary book, they give you a, a little background information about everything in the start, in the first paragraph. And first they actually give you a classification. So the classification is on the first page of every chapter, and you need to understand that classification, and you need to learn the classification. I don't know if I can show you the pages. I'm not okay. I can, or maybe I should. I don't know. Look, this is chapter 6. I'm just showing you a page. So you see here, I have marked that this was a question that has come in my UQs, that is the university questions of the past papers. So I know that enumerate is important. This is important. This is very important, and this classification actually came twice in the test, in a test for me. So I know this is important. Then these important words that the teachers also had in their slides. So this is how you do it. Coming back about the squamous cell papilloma, so you underline anything that you feel like a question can come on, and about everything else you also need to know the diagnosis. So you should study everything, like you're going to be you will be asked to diagnose it. So you need to be studying it in that manner. So you also need to know the clinical features. So for everything that you study, you need to know the clinical features, you need to know the histopathology, you need to know the radiographic features, and the treatment is not very important in this specific case, in these oral pathology cases. The treatment is important for oral medicine, and when you're talking about the treatment, you will do the if you do the treatment over here in oral pathology, it will help you a great deal when you're doing oral medicine. So yeah, so these are the very important things that you need to do. So I've told you about 4 things, like how to study oral pathology. I hope this video helps you, and please tell me in the comments if this video lacked anything. And I'm sorry about the movements that I'm making. I'm moving a lot, and that is because I'm using my phone camera to make this video. And please give me listen to the video more and see less of the movements and all. So yeah, if the video helps you, please let me know. And if you want something else related to oral pathology, please let me know. Thank you, and please give your feedback in the comments. Thank you.